Make sure to read the medication guide and instructions for use provided by your pharmacist before using the Humira, CF, pen injector kit. If you have any questions, don't hesitate to ask your doctor or pharmacist. If you are using this medication at home, make sure to learn all preparation and usage instructions from your healthcare professional and the product package. Before using the medication, visually check the product for particles or discoloration. If you see either, do not use the liquid. If you are taking the medication from the refrigerator, let it sit at room temperature for 15 to 30 minutes before injecting. Do not try to warm up the medication any other way, like by heating in the microwave or placing in hot water. Before injecting each dose, make sure to clean the injection site with rubbing alcohol. Change the injection site each time to avoid injury under the skin. New injections should be given at least 1 inch from an old site. Do not inject into any areas of the skin that are sore, bruised, red, or hard. Use the medication exactly as prescribed. Inject it under the skin on the thigh or abdomen as directed by your doctor, usually every other week or once a week in some cases. The dosage is based on your medical condition and response to treatment. In children, the dosage is also based on weight. If you are using this medication to treat psoriasis, hidradenitis suppurativa, Crohn's disease, ulcerative colitis, or uveitis, your doctor may prescribe a different schedule/higher dose at the start of your treatment. Make sure to follow your doctor's directions for using this medication carefully. Learn how to store and discard medical supplies safely. Use this medication regularly to get the most benefit from it. To help you remember, mark the day on the calendar when you need to receive this medication. Do not increase your dose or use this drug more often or for longer than prescribed. Make sure to tell your doctor if your condition lasts or gets worse. If you experience redness, itching, pain, or swelling at the injection site, make sure to tell your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they believe the benefit to you outweighs the risk of side effects. However, you should still be aware of signs of infection while using this drug, such as a sore throat or fever. Be sure to tell your doctor right away if you experience any serious side effects, such as changes in your heartbeat, mental/mood changes, or vision changes. It's also important to note that adalimumab may rarely cause serious liver disease, so your doctor may order blood tests and monitor you for symptoms during and after treatment. If you experience any very serious side effects, such as seizures or chest pain, seek medical help immediately. And if you notice any symptoms of a serious allergic reaction, such as rash or trouble breathing, get medical help right away. Remember, this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. Before using the Humira, CF, pen injector kit, it's important to let your healthcare provider know if you are allergic to adalimumab or any other adalimumab products, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. It's also important to inform your doctor or pharmacist about your medical history, especially if you have had current, recent, or repeated infections, blood or bone marrow problems, seizures, certain brain or nerve disorders, cancer, heart disease, or lupus. Adalimumab can increase your risk of getting infections or may worsen current infections, so it's important to avoid contact with anyone who has an infection that may easily spread. It's also important to talk to your doctor if you have been exposed to an infection or for more details. Before having any immunizations or vaccinations, be sure to inform your healthcare professional that you are using adalimumab. It's also important to avoid contact with people who have recently received live vaccines. To lower the chance of getting cut, bruised, or injured, use caution with sharp objects and avoid activities such as contact sports. Before having surgery, be sure to inform your doctor or dentist about all the products you use, including prescription and non-prescription drugs, and herbal products. Older adults may be at greater risk for infections and cancer while using this drug, and during pregnancy, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. Additionally, this medication passes into breast milk, so it's important to consult your doctor before breastfeeding. Drug interactions can alter the way your medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Do not make any changes to your medication dosage without consulting your doctor first. Some products that may interact with Humira, cf. pen injector kit include other TNF blockers, such as etanercept, infliximab, and other drugs that weaken the immune system, such as abatacept, anakinra. If you suspect an overdose and the person is experiencing severe symptoms like fainting or difficulty breathing, call 911 immediately. Otherwise, contact your local poison control center right away. In the U.S., you can reach the Poison Control Center at 1-800-222-1222, and in Canada, contact a provincial poison control center. Remember, it's important not to share this medication with others. Your doctor may also want to monitor your health with lab tests while you are using this medication, such as complete blood count and liver function tests. Be sure to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, consult your doctor or pharmacist immediately to reorganize your dosing schedule. Do not take a double dose to make up for the missed one. When using the Humira, cf. pen injector kit, be sure to store it in the refrigerator, but do not freeze it. Some brands may also be stored at room temperature, so check with your pharmacist or read the product package for specific storage instructions. Once the medication has been stored at room temperature, it should not be put back in the refrigerator. Keep the medication in the original container to protect from light, and discard any unused portion. Also, remember to keep all medications away from children and pets. When it comes to disposing of the product, consult your pharmacist or local waste disposal company, and do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.